Hi, I'm Ashley Edwards. I'm a livestock extension agent and coordinator for animal science programs in North Louisiana. I want to visit with y'all a little bit today about the use of estrus synchronization for natural service. So again, we're talking turning your bulls out just like you normally would and not using artificial insemination. So how can you capitalize on the use of administering these hormones in a protocol for your operation? Now, I know most of the time you're thinking, okay, this is going to be a little bit labor intensive, but it doesn't have to be. So a little bit later on, we'll talk about the different protocols that you can use, but I want to start talking about the benefits of it. So if you haven't already, you want to go watch Mr. Jason Holmes's video on the economic side of it, particularly of using that defined breeding season and what this can offer you in terms of dollars and cents. If you want to talk about it from a labor standpoint, again, the protocols can be tweaked to match your operation and what you have. But let's think about it on the calving end. So if we know when our cows are bred, and if we get the majority of them bred early in the breeding season, then they're going to calve early in the calving season. So particularly for our guys that might not be raising cattle as their primary source of income, you can look at your calendar and you can plan when those calves are coming so that you can be home and make sure that you're there just in case you're needed. A few assumptions that we're going to make as we move forward with this. One, of course, all of our cows or our heifers need to be open. There's no point in using estrus synchronization, and it could actually hurt a pregnancy if she was bred. I want to assume too that your bulls are in good condition and that you've gone through a breeding soundness exam with those bulls. So assuming that all those things are happening and we're moving forward, talk about the bulls for just a moment. And breeding pressure actually does not change that much if you're implementing an estrus synchronization protocol. So our rule of thumb has always been you want to turn that bull out with a number of cows equivalent to his age in months. So if we're talking a 2-year-old bull, you're looking at 24 months of age, so somewhere around 24, 25 cows is what he can handle. Now you do have to realize that we probably want to use a more mature bull if you're going to use estrus synchronization, just in the sense that when you turn them out and those cows come into heat all at once, and they have not been out with the cows, they're going to get a little overzealous and a little excited. So oftentimes, especially if this is the first time you're using estrus synchronization and you're not really used to it, you might want to consider using a more mature bull. So in just a moment, we're going to go and we're going to talk a little bit about those hormones and exactly what they can do and what protocols you should use. All right, so we've moved chute side, and I want to take just a second to talk about some of the hormones that we're going to use. So two main hormones. The first, progesterone. So you hear progesterone, think pro meaning for, gest meaning gestation or pregnancy. So progesterone actually supports pregnancy, so it gets a little bit confusing there. But what it does is it suppresses estrus, and it is used in a lot of our synchronization protocols. So the most common form of progesterone that you would see is going to be a cedar, okay? So it's going to look like this, and I'll show you in a minute how to put one into a cow. It comes in a bag, so C-I-D-R, cedar. So that'll be your progesterone source. And then the other hormone that we use a lot is prostaglandin. And prostaglandin can be used by itself, or it can be used in a protocol with progesterone as well. So we have a bottle of Lutalice here. Estramate is also a prostaglandin that you can use if you just whichever brand. Honestly, as far as efficiency, they're about the same. So cost and efficiency, relatively similar. It just depends on what you want to do. They do now have a high dose of the Lutalice to where you're given only about, I think, 2 mils, whereas we were giving closer to 5 originally. So make sure you just read the bottle, read the instructions and what you have there. As far as cost of these, one shot of prostaglandin is going to be around $2 to $3. One cedar is going to cost you around $12.50 to $13. So depending on the protocol that you use, you're looking at anywhere from $3 to up to about $15. Going into the protocols, the simplest one that you can do that only brings the cows up into the chute once is a 1-shot prostaglandin. So that's 1 shot of Lutalice or 1 shot of Estramate. And what you would do is all of your open cows, you would bring them up and you would give them all a shot according to the label instructions, and you would turn them out with the bull. Now what you're going to see is 70% or so of those cows will come into heat within the first 5 days. Some research pushes it up to 75 to 80%. I always err on the side of caution and say estimated 60 to 70% of those cows are going to come into heat within 5 days. The next protocol that you can do is a 2-shot prostaglandin. So you bring all the cows up, like I just said, give everybody a shot of prostaglandin, turn them out with the bull. Now you're going to want some kind of marking device. So Estrotech patches on the tail head, a chin ball marker on your bull, something along the lines, something that will tell you that that cow has been mounted by that bull and she's been serviced. If the cows have not been serviced, if they've not come into heat within 10 days, on day 11, everyone that has not been serviced comes back through the chute and gets a second shot of prostaglandin. And everybody else should come into heat. All of those that you just gave that second shot to should come into heat within the next 5 days. Okay, so that's the first 2 protocols, a 1-shot prostaglandin or a 2-shot prostaglandin. And either way, you're looking at pushing 70% of those cows to come into heat within the first 5 days. Now, not all the cows are going to get bred. There's going to be all the nature factors that come into that, but the vast majority of them should be serviced, and hopefully you're getting good preg rates there. Let's bring the progesterone into it and bring the Cedars into it. So what you would do is you'd bring your cows up, you would insert a Cedar, it's an intravaginal device. You'd place that Cedar and you would leave it in for about 7 days. There's some leeway in there if something happens. A Cedar can stay in for 2 weeks if you need it to. But most protocols are going to tell you 5 to 7 days. I always use 7 as a rule of thumb. Put the Cedar in, leave it in for a week, and you can come back and you can pull that Cedar. Now when you pull that Cedar and remove it, you have 2 options. One, you can just turn the cows out and you'll see 70 to 80% of them come into heat, probably about 80% honestly, come into heat within the first 2 to 5 days. The other option is when you pull that Cedar, you can give a prostaglandin. Okay, so you take the Cedar out, give that shot of prostaglandin. And again, you're going to see 70 to 80% of those cows come into heat. But what that does, what adding the prostaglandin does, is it gives you a tighter synchrony. That means that more of the cows are going to come into heat closer to 2 days after you give that injection compared to the 5 days. So we just get a little bit tighter synchrony there. More going to be bred around day 2, maybe day 3, compared to spreading it out between day 2 and day 5. So again, 3 simple protocols: a 1-shot prostaglandin, a 2-shot prostaglandin, or a Cedar. And then if you want to add that prostaglandin in with the Cedar, you can do that as well, which I guess would kind of give you a 4th protocol that you could follow there. So that's going to bring your labor in the breeding season. All right, so think about that. Think about what you want to do. I know a lot of guys will actually bring those cows up and they will put those cows into a trap. And as they get bred or as they get serviced, they turn those cows out. And then that way, if they're going to give that second shot of prostaglandin later, they can run them back through the chute and they don't have to go through and sort. They already have the cows that have not been bred up there in the trap and ready to go. Let's touch on heifers for just a minute. If you are going to be synchronizing heifers, you need to use a progesterone protocol. Okay, so if you're using heifers or if you're breeding heifers, you want to use a Cedar. Reason for that, simply, I guess, is that the brain and the reproductive tract of those heifers are not quite communicating well enough yet. So as they mature, we get that good communication going back and forth between the hormones in the brain and the hormones in the reproductive tract. On our heifers, their first breeding season, there can be some cross wires and things like that that's going on. We're just not quite hitting those receptors that we need to with those hormones. So if you are talking heifers, you definitely want to use the Cedar or the Cedar with the prostaglandin shot at the end. So if you have questions on those protocols, you can definitely reach out to me. What I want to do next is I want to show you how easy it is to place a Cedar into a cow. Okay, so when we start to prep for the Cedars, first thing, it's good to wear gloves to keep the Cedar clean. Again, this is going to be in her for about a week. So you want to protect her. Ladies, there is progesterone on this. If you go through and handle enough, it's coating the outside, and I know some girls that get really sick if they start to handle these and hold on to them for a long period of time. So women, it's always nice to go ahead and wear gloves too. This is your applicator. You want to make sure that you purchase an applicator when you buy your first set of Cedars, and you can clean the applicator in between cows. But you see these wings on here, the tail that will stick out. And you want to just fold the wings down and place them in like that, okay? And then you can put a little bit of lube on the end if you want to, and we're gonna go and we'll show you how to place it into the cow now. Okay, so we come up and I've cleaned her off some. We'll open the vulval lips and just slide it into the vagina all the way in. And then there's just a really easy press release and it will slide out like that, okay? So you want to make sure that the Cedar's all the way in. There's no white sticking out of her. I know it might be kind of hard to see. She's a black cow, but you can see the blue tag or the blue tail here on the Cedar. When you go to remove it, it's as simply as pulling it out like that. All right, so as we wrap up, just to summarize again, I want to refer you back to Jason's video where he talks about the economics and the increase in pounds of calf that you will get earlier in the breeding or in the calving season, and overall dollars and cents increase that you're going to see when we have those calves born early in the calving season, particularly if we can get 70%, ideally would be great, but 60 to 70% of those calves born within the first 21 days of your calving season. When you start thinking about your estrus synchronization protocols and which ones you want to use, think about the labor input during the breeding season and the efficiency that you're going to have during that calving season. Sit down and think about that. Think about, are we breeding cows or heifers, because then that's going to tell us which hormones we need. Again, if you're using heifers, you want to use that progesterone, which was on that Cedar device that we had. If you're using cows, you have any of the options. You can do the prostaglandins, the 1-shot or 2-shot, or you can come in with that Cedar as well. So you saw how easy it was to apply that Cedar, how easy it was to remove. The shots are very simple as well. And so you're looking at, again, anywhere $3 for a shot of prostaglandin, maybe $2.50 depending on how many you're buying. And then that Cedar is going to be around $12.50 to $13. You will have the cost, of course, of a little bit of syringes and needles and just gloves and things like that added to that. But in the end, it is definitely worth the cost that you're going to put into that estrus synchronization once you sit down and you put everything on paper, pen to paper. If you have questions on any of this, I did not get into the endocrinology and how the hormones work in the body, but I love to talk about that. So if you want to sit down for coffee or lunch, we can do that. But any questions you have, please see me or Jason.